Welcome to Successful Living with Bill Napick. Every week we talk with interesting people in a variety of professions, and along the way, get ideas to enhance success in all categories of your life. Successful Living with Bill Napick starts right now. And here's your host, Bill Napick.
Welcome to the show, Successful Living with Bill Napick. And today, Successful Living with Robin Mooney. She is the CDO and co-founder of the J. Flowers Health Institute. In fact, we are here right now. Robin, welcome to the show.
Thank you, Bill. It's just a pleasure to be here.
As I was saying earlier, every time I enter your building here at the J. Flowers Health Institute in the center of the country, Houston, Texas, I feel the growth. I feel that you're helping people in new ways all the time. The message is out that you're here. Let's tell people your role at the company.
Sure. And yes, you're right. You've observed correctly. We have grown. This is our third office. We've moved up to uptown Houston in a beautiful area, and we've really expanded with staff and wonderful people helping others. That's what we do. So my role with J. Flowers Health Institute has been from the beginning. I worked with Dr. Flowers at my previous job. I would see him on the road. We'd go to educational events together. I really loved his philosophy. It was the same philosophy that I had, that whole person wellness, helping people, wanting to get to the root cause. And that's really, I think, what I'd like to talk about today, Bill, is the root cause is making sure when someone has a problem or an issue with their health, the key is getting to the root of the problem and then making that clear diagnosis so we can treat properly. If you don't have a clear diagnosis of what the problem is, you could keep going for help, but there's not ever a clear answer. So I think that's just so exciting on what J. Flowers Health Institute is doing. And so my journey here was meeting Dr. Flowers on the road, again, his philosophy and what we do here, treating the whole person. We like to say the body, mind, and soul. Someone will come to us and we do a living MRI, you could say. We like to treat and really evaluate and test individually, so there's not any group settings. It's all in an individual concierge approach, which is super exciting. That's just the wave of healthcare and how it's trending, is people like to be able to get into a specialist immediately and not have to wait 9 months to see someone. And that's what we can do here at J. Flowers Health Institute because of our connections with the Texas Medical Center. We're right in the hub. So it's just been really exciting to be able to help people on that level. So my role is marketing and business development with J. Flowers Health, and the creative side of working on our website, making outreach to folks, talking to families, talking to professionals that work in our industry or professionals and executives that don't work in our industry to get the message out there of what we do.
And when you talk about helping people in their individual potential problems, we are all works of art. There's no one else like you or me or anyone else. So our strengths, abilities, and even our challenges are unique to that. So this approach that you're using has so much insight, and it's been working in a tremendous way here helping people.
Yes, absolutely. That's correct. And I believe what's beautiful about what we do is it is the individual approach. Each person comes to us. They see their providers one-on-one. There's not any group setting. It's not in a clinical setting. So they feel right at home. They feel like they are getting a 7-star treatment. Each client has a companion that they would go to their appointments with during the day. We call our companions client liaisons. So they're not alone. They're moving through our whole process, 5 to 10 days of really intensive but comfortable testing and evaluation so we can get to that root cause.
And you have a tremendous team right here at the J. Flowers Health Institute to do all these things. But I'll mention as well, as you're helping people that may have a problem or maybe several and their own unique problem, in addition, you're helping people that things are going well and we may just want to evaluate where we're at so that we continue being healthy and having the right strides in life. But in addition, every once in a while, from a recovery standpoint, there are people that fall in, and we've talked to Dr. Flowers about this just, I think, last show. There are people, we fall into certain addictions of all types. Your menu of help, you can help someone maintain what they're doing. We fall into a problem, an addiction. or a health problem of another nature, you're here for all those things.
Yes.
That's incredible.
Yes, thank you. And we treat very high complex medical cases. We evaluate high complex medical cases. We evaluate adolescents, young adults. We also work with a lot of interventionists that are helping the family to help their loved one get the help that they need. A lot of times families are struggling because they don't know quite how to help maybe their child or their sister or brother or spouse. So we have a plethora of professionals that we can call on to help the family move forward in a recovery process and move forward to getting better and feeling better. So if you have a loved one that is in a crisis and you don't know what to do, pick up the phone and give us a call, and we can help you move forward with getting well with the family, and hopefully the loved one can move forward with getting well and finding the peace and the joy that we all want to have. So yes, the high complex cases, the adolescents, young adults, and those that are really having a hard time, maybe even we like to call sometimes failure to launch clients that are struggling because maybe they lost their job during this year of 2020 of the things that are happening this year. Maybe they have been ill or chronic pain, or could be a number of things. And we really, we're here for answering those questions, and hopefully can help somebody really blossom and be abundant with living.
As we think back, 2020 has been, to say it's been a unique,
Yes.
crazy year is an understatement, but it dawns on me, too, as our lives have changed. We've made all kinds of adjustments. We have new interest in certain things. People are renovating homes. They're buying homes in rural areas. All sorts of things are happening, but it also dawns on me, 2020 for some people could have been the year of a birth of an addiction.
Right.
Because of the weird scenario that we're
Correct.
in. So all kinds of things are happening. You
Right.
probably have seen that
Right.
as the year has unfolded.
Yes, absolutely. And I've felt it myself. I mean, just the anxiety and depression. And even though, I'm working and I'm functioning, but still just the uncertainty of the country and, the health of your loved ones can create a lot of mental health and psychological and physical problems. And we have seen that definitely. There's a rise. Like I said, for me, myself, I've felt it. And I'm sure there's many people out there that do. And as both of us are, executives and working people, that there's the people that executives and professionals that need help too, that they may look great on the outside and they may be holding their job down, but they're suffering on the inside. And we can certainly help get to the root of what's going on at that point too. Yes.
You said earlier, as you mentioned the word family.
Yes.
So whether it's a health problem of some kind or if it's an addiction, it's usually not just one person. Those things affect the family. So
Correct.
your awareness of that and your ability to bring that family in on the treatment and on the way to the road of recovery and
Yes.
maintaining that recovery,
Right.
that's very important as well. Sometimes we forget about how, whether it's an addiction or something else, can affect others.
Correct. We call it a family disease. If there's someone in the family that has an addiction, and it could be shopping, it could be food, it could be alcohol, it could be prescription drugs that their doctor prescribed. All of those can lead to something clicks in someone's body, and all of a sudden they just can't stop. And yes, and it affects the whole family when the loved one or the person with an addiction or a mental health issue has problems. It really does. It's one of those effects where the drop of water makes a ripple effect, and it does. It affects the whole family. And we are really good at working with the families through this process, so everybody can feel well and be well and live their fullest life.
We're talking with Robin Mooney, the co-founder of the J. Flowers Health Institute. And by the way, the website is jflowershealth.com. That's jflowershealth.com. Robin, when you and Dr. Flowers started the J. Flowers Health Institute, that was before 2020. But you must have had some kind of insight into the need And the brilliance of having it right here in the center of the United States makes it easy to go anywhere in the United States and other countries. This particular spot in Houston, close to medical care, close to all kinds of things. Also, by the way, very close to shopping. So if you have that shopping problem, it's a good place to cure it because it's right here.
Absolutely.
But all that said, as one of the founders, what did you see as you were planning before you even opened the doors? What were the things that were in your mind that you said, we see the need for this, and here's how we could step up and set up to serve these issues?
Absolutely. So we saw the need that we both, Dr. Flowers and myself, have worked in the healthcare industry for years. Unfortunately, many people go to get help and they go to the wrong place because they don't have a clear diagnosis. And so Dr. Flowers approached me and said, I'd really like to open a center that would be more of a concierge approach for healthcare that can pinpoint and get to the root cause of people's issues and health concerns, because there's so many people that go to get help or go to treatment for addiction or mental health, and they go to the wrong center and they don't get help, and they repeat over and over trying to get help, and the doctors aren't talking to each other, the centers aren't talking to each other. And so he really wanted to do a collaborative approach with, like you said, being in the middle of the Texas Medical Center, having all these wonderful specialists at our fingertips, the wonderful office clinicians and professionals that we have working with us here. That is what we felt that was missing, was getting that really clear, concrete diagnosis to be able to help somebody with their future health. And that's where that need was. The need was getting to the root of the problem, and we felt that that was missing in the whole U.S. I mean, there are definitely some really good assessment programs and some evaluation programs, but Dr. Flowers, with his training, he learned it's a body, mind, soul approach. It's not just a medical approach. It's not a psychological approach, a mental approach, a spiritual approach. It's all of them together, and we need to look at that whole person, a 360-degree look at someone. And so that's what makes us special, was we take that 360-degree look, and I'd like to say, I guess, Sherlock Holmes, and we get to the root, and then we help with the future health of a treatment plan for whatever those diagnoses are.
That's right, because we as a person have so many components and so many things are at play all the time. It's fascinating. The other thing, when we talk about successful living, a lot of people have ideas. No matter who we are, we're like, oh, I have an idea for an invention. I have an idea for a service business. I have an idea. You had an idea, and Dr. Flowers, but you did something about it. You figured a way to do something. You enlisted each other, I suppose, at the beginning, and then assembled a team.
Yes.
So those are the mechanics of doing something in terms of business and doing something great, serving a need. I guess my point there is that if you have an idea, sometimes you should just do it, right?
Correct.
I mean, I bet there's so many ideas that people have had that will never happen because they didn't go forth. They didn't take the chance. In this one time we have to live on this earth, hey, sometimes we should take a chance and have an educated plan and go forth.
Correct. And I truly believe that as well. And we took action. We did. We took action. We saw the need and wanted to help people. J. Flowers Health Institute is, I think, just prime example of finding that need, seeing and following our passion. One of my passions is to be of maximum service to mankind and to see how I can be helpful. And with my marketing skills and my, I guess, background with treatment and mental health, it just was the perfect mix. And then with Dr. Flowers, with his background and his expertise, we came together, and I feel like we were a dynamic team. And he calls me his road wife. I'm his, and he's my road husband, because before we had this healthcare issue in 2020, we were on the road a lot and speaking. He was speaking at educational events, and we were putting networking dinners together and things like that, so people could learn about what we do. and how we can help people. And so it's been a really fascinating journey. I've learned so much in the last few years working with Dr. Flowers and this incredible team that we have. And being in Houston, I love Houston. This was the most time I've spent here. We actually adopted a little puppy from one of the centers here years ago, and that's one of my other passions is saving and helping animals. Yes, and I'm just grateful about that. But Houston is a fantastic place, and I'm super excited to be in the heart.
It really is, and you've assembled such a team here. Mm-hmm. And I would mention to people, go to my website, radiobill.net, to see if you did not see or hear the interview with Dr. Flowers, actually several.
Yes.
And what you'll find as we talk about J. Flowers Health Institute, Robin Mooney, and Dr. Flowers putting this together years ago, you're going to find everybody on your team. Dr. Flowers, has such an engaging and insightful way and demeanor with people. That's so important. It's easy, as you mentioned him, he's just a tremendous guy.
Yes.
And you could see how he's able to help people and has the demeanor where people will open up and be able to have good communication, because communication is key in all endeavors, and certainly getting better, staying right and healthy. Right. Communication is right there.
Yes.
We're at the end of the year. Can you imagine? And thank goodness we are. But as you look forward here at the J. Flowers Health Institute, it must be exciting, some of the things that you have in your meetings as you look ahead, based on what you've done so far, and you go further. But also, I do want to mention Robin French. You talk about a team.
Yes.
You've assembled a magnificent team, and Robin has been a tremendous addition. In fact, why we are here on the radio today. But as you look ahead with your team members and the people you're serving, what do you see beyond, well, certainly 2021, but even beyond? What are some of the visions that you have in places like you'd like to take this?
Well, we definitely feel like we're going to grow, and we have been. It's been the third office, like I mentioned. We've just grown and added more staff. And, I think my vision for J. Flowers Health Institute is to help more people get the word out. I think just expanding so we can help more people. That would probably be the most important thing.
And that's one of the things I'm seeing, too, is you are getting the word out, certainly on this radio show, but in addition, people could subscribe to your podcast, Understanding the Human Condition.
Yes.
You've already have, I'm losing count now of your episodes, I'm guessing about 7 or 8, but they're all full of great information.
They are.
Dr. Flowers is on there. You have guests.
Yes.
So if someone wants to, they can go to any of the podcast sites.
Correct.
Understanding the Human Condition.
Yes.
Subscribe to that and stay tuned
Yes.
and learn, and then also see what's going on here at J. Flowers Health.
Fantastic guests are on every week, and Robin French and Dr. Flowers do a great job of being with the guest and getting important information out on all types of things, healthcare and life and success, and mostly just trying to live the best life we can and how to do that.
One of the things you mentioned, too, is a little earlier you talked about when we see people, we may see a couple, a person, we have a perception, and automatically somehow the mind just goes to, we assess and say, oh, they're successful, oh, they're happy.
Right.
And it's been said a million times, things aren't what they seem.
Correct.
And one thing strikes me, sometimes, especially on Facebook, you see people in relationships that seem to be promoting that, hey, look how happy we are. And yet those are sometimes the ones where it's divorce.
Correct.
Or the most vulnerable of relationships. If you have to prop it up and keep, hey.
Yes, I would just
things
say
aren't what they seem.
They aren't, but I would just say, reach out and try to get some help, and it's okay. We all have issues, we all have problems, and we have to talk about it. We have to get it out and talk about it, and it can get better, and it does get better. So I would just say, pick up the phone, give us a call, give someone a call, and just reach out. And you're not alone. I would have to say too, you're not alone.
So let's itemize again some of the things. If someone's out there and they say, hey, I think I need a little bit of help, or they might even be saying 2021 is going to be here. I want to be in great shape. I want to have my evaluation. They can do that where they have a health evaluation. You provide that.
Yes.
Or if they have a certain problem, they can reach out, jflowershealth.com.
Right.
What else would you like people to know before we close the segment?
Sure. So they can come for an evaluation. Absolutely. We do such a good job. And after the evaluation, they can also stay with us for a wellness program or restoration program. Again, everything is concierge, 7-star service. We do such a good job at getting to the root of the cause and then helping somebody with their future health. So we can take someone all the way through our concierge detox to our comprehensive diagnostic evaluation program into our wellness programs. And then we also do concierge aftercare. So we can take someone from the beginning to the end and helping somebody definitely find their future health and continue to flourish and really grow body, mind, and soul.
Important to point out, we're here, J. Flowers Health Institute, right here in the center of the country.
Yes.
Houston, Texas, but you are serving people not just in Houston, and people will hear this broadcast on the internet far beyond, but you're serving people even outside of the United States and
Yes.
even in other states and cities.
Yes. And I have to say, it's so safe. It feels so safe to fly right now. I feel like it's safer than grocery stores. Everybody is so controlled. You have a mask on and the airlines have been so good. Don't be afraid. At least I'm not afraid to get on an airplane. And we serve so many different states and different countries. And not only our Houston local market here we're here to help, but nationally and internationally. We are easily, because we've got 2 great airports and private airports, and it's just easy to get to us.
We're talking with Robin Mooney, co-founder of the J. Flowers Health Institute. With the last minute or so, Robin, what else would you like people to know?
Just thank you for having me on. J. Flowers Health Institute is here, like you said, right in the middle of Houston, very accessible. We're here to help. If you have a loved one or your family is suffering, please just reach out. We're a phone call away, an email away. You're not alone.
The phone number for the J. Flowers Health Institute is 713-783-6655. That's 713-783-6655.
So just take some action. That's one of my mottos is take action and don't be afraid.
I think that's going to be my new motto. Do not be afraid. Go forth. Enjoy life. You've been listening to Successful Living with Bill Nampick, and today with Robin Mooney, co-founder of the J. Flowers Health Institute. Thanks, Robin.
Thank you so much, Bill. This has been a pleasure.
It has been said, our health is our wealth. If you or anyone you know is suffering with mental health, addiction, or a complex medical issue, the J. Flowers Health Institute, located right here in Houston, is here to help. The J. Flowers Health Institute specializes in providing comprehensive health and wellness evaluations for individuals who want to improve their quality of life. Every client at the J. Flowers Health Institute receives personal one-on-one concierge service and a workable plan for future health. For more information about the J. Flowers Health Institute and its concierge services, go to jflowershealth.com. That's jflowershealth.com, or call 713-783-6655. That's 713-783-6655. And be sure to mention you heard about them on the Successful Living Show. Again, the number is 713-783-6655, or go to jflowershealth.com.